comes as far as the surge in COVID cases is concerned. We're taking a look at what exactly has been recommended by the state health department in Karnataka in particular. The Karnataka government has mandated home isolation for COVID positive patients. Karnataka has in fact issued an advisory that all COVID positive people must henceforth isolate at home for 7 days while their symptomatic primary contacts should be tested. This decision has been taken by a cabinet subcommittee on COVID-19 under the chairmanship of Karnataka Health Minister Dinesh Gundu Rao. This, of course, the latest that we're tracking for our viewers. Joining me is my colleague Madhu Sharma. Madhu, over to you. What can you tell our viewers about the decision made by the Karnataka state government?
Well, to prevent the spread of COVID infection, Karnataka government has mandated a week's home isolation for all COVID patients, and Health and Family Welfare Minister Dinesh Gundu Rao, after meeting the cabinet subcommittee set up to monitor the COVID situation in the Karnataka state, said that it would direct both government offices and the private sector to ensure patients can take paid leaves during this period. And Dinesh Gundu Rao further said that in case the patient is hospitalized, the employees should allow the patient to take leave until they recover completely, and to ensure the patients are provided patients are provided care and medical attention. The health department's official will visit the patient's home under isolation and regularly monitoring their situation. And also in Bangalore, the doctors working at Namma clinics will visit patients under home isolation and keep a track of the conditions. Similarly, the doctor from Taluka and district hospitals will monitor patients under the jurisdiction of officials, jurisdiction of their concerned jurisdictions, and other officials will also keep a close watch on the patients who are admitted in the hospitals. And as of Tuesday evening, 423 COVID patients were under home isolation across the Karnataka state, and noting that the infection could spread faster among the children, Dinesh Gundu Rao urged patients not to send anyone outside when the isolation is there, and urge parents not to send children to school if they have like COVID like symptoms, and they should monitor the condition of the children at home and get them tested if required, is what the ministry has suggested. And while we see that the New Year restrictions are there and Christmas restrictions are also there, he urged people to exercise caution and follow COVID appropriate behavior. And further, he said that there is no cause for panic, but the government will follow preventive measures, and will also issue a standard guidelines for the public welfare. And the ministry in fact has advised everyone to wear mask and follow social distancing at the crowded places.
All right, Madhu, thank you for joining us. And also with us on the broadcast is Dr. Ishwar Gilada, who's a health expert. Sir, good morning and thank you for joining us on NewsX. Once again, we're of course addressing the surge in COVID cases. Karnataka government has now mandated a 7-day home isolation for COVID positive patients. How do you view this move?
You see, I have been clearly saying since beginning, there is no need to panic. The COVID variant currently, or subvariant even JN.1, is not very infectious, which was initially thought that it could be very infectious. Secondly, it is giving rise only mild symptoms. Now, 3 deaths in Karnataka, there should be a death analysis to find out what are the deaths, what are the ages of those people, what are the comorbidities. What happens is, if people are aged and with comorbidities, it is just like a last straw on the camel's back. And sometimes COVID positivity is an incidental finding rather than a real problem of cause of death. So we should analyze between 2 things, whether the person died of COVID-related illness or COVID was just positive and person died of something else. Number 2, at this present, mask need not be mandated. It should be requested. And even if you mandate, people are not going to use, because people know that in a country of 143 crore people, there are hardly 400, 500 cases are being detected daily. Lastly, currently we don't need any COVID mania or COVID-centric policies. We need to have a ILI, that means influenza-linked illness or influenza-like illness. That kind of policy, whether it is an influenza, whether it is RSV, whether it is a COVID. What happens is, when you make only COVID-centric policies, you neglect all other diseases, all other infections, all other problems, and you become only COVID, COVID, COVID. Now, what should be done to a person who is having a COVID-like syndrome, COVID negative, but influenza positive? Then you don't look after, because it is not part of your policy. So I think this kind of policy At 4 years after knowing COVID, they are wrong. We don't need anything to panic. We don't need anything to plan for COVID as a per se. We need to only wait and watch. And particularly when the WHO said this is a variant of interest. It is not variant of concern. When there is a variant of interest, to whom it is interest is only scientific community, medical community, government planners. It is not for common people. Unless and until it becomes a variant of concern, common people need not be involved. No panic, no advisory to them, nothing. Only protect 60 plus population with severe comorbidities, uncontrolled comorbidities. Nothing else is required than that.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.